An ER doctor and mom reviews the Lifevac and the Dechoker, Part 2, Demo Day. Of course, I can't recommend or review any product that I haven't first tried in my patients or in my own home. So I tried this on my family, and I'm going to be demoing it on my hubby. Say hello, hubby.
Hello.
Don't worry, no hubbies were harmed in the making of this video, at least not significantly. So the Lifevac comes in a number of different sizes, and here is how it's meant to be used. Put the person flat on a hard surface, push the mask in, then you're going to place this mask over their nose and mouth. Then with one hand holding that mask against their mouth, you're going to push in on the Lifevac. Then while one hand is still holding the mask on their face, you'll pull back with a swift tug on the other hand. So let's try it. Oh, okay, that didn't work. In that attempt, the mask fully disconnected from the handle. Okay, that one didn't work. Last time I didn't have a good seal, so it didn't work. In that one, I got a really good seal, as you may have heard from my husband's poor face. But when I asked my husband, he said that most of the suction was at the front of his face and mouth, although he said he did feel some at the back of his throat. Not much suction in that one there. Okay, that one lifted up your face.
Yes.
He's an orthopedic surgeon. They don't need all their brain cells anyway. This is not really how we're trained to hold a mask. I'm going to try it the way we're trained. Making a C with my finger, and then my other 3 fingers are on his chin. How did that work?
Very tight seal.
Was that the best? I found it actually the most effective when I was using it in the way that we are trained to hold a mask on a patient's face, because it enabled me to actually get really good seal without just squashing down on his face. That said, if you're not trained in how to do that, you'll just want to follow the instructions for how the manufacturers say it. Both for the Dechoker and the Lifevac, it's really good to know when you press in, the air goes out the side. So it's not like the air is going into the patient's mouth, which could push down their throat further. Secondly, you have to hold this device right on the top. When I was first learning how to use it, I was holding it here like a joystick. Doesn't work. So you have to make sure you follow the manufacturer's instructions and hold it at the top. Overall, I wasn't impressed with the Lifevac. I was actually pretty disappointed. Number one is time. It's equipment, so it's going to take time to set it up and set up the patient. And it didn't work for me every single try. So every time you try it and either you don't get a good seal or the mask pops off or you have some other equipment failure, is wasted precious seconds. Number two, multiple of my attempts, especially at first, didn't have enough suction and you lost the seal. If you lose a seal, this doesn't work. Number three, those that did have a lot of suction had a lot of suction on his face and on his cheeks. It had some suction in the back of his throat. Would it be enough to suck out a foreign body more than you could get from back blows or abdominal thrusts? I'm not clear on that. Now, lastly, this is really important. The instructions in this say roll the person on their side and then sweep their mouth for any debris. That is an absolutely hard no. You do not want to do a blind finger sweep on somebody who is choking. Now let's try the Dechoker. So the Lifevac has one handle, multiple masks. Dechoker instead comes in different sizes, but on different kind of plunger type thingies. A big difference between the Dechoker and the Lifevac is that the Dechoker has this tube. They refer to it as a tongue depressor. So you can see the Lifevac doesn't have that. In theory, this is supposed to create more of a suction and negative pressure at the back of the throat. But in reality, I found that it actually caused some difficulties. Instructions for the Dechoker are right on the side. And they say here to follow the Red Cross and the American Heart Association protocol. Now, importantly, Dechoker nor Lifevac are not part of the Red Cross or the American Heart Association protocol. Really clear. They are not part of that. So what they're saying, which isn't entirely clear if you look at this, but what should be said is that you should try the American Heart Association and Red Cross choking protocols first, and then if they don't work, then you reach for the Dechoker. That's what they say in the fine print. Here's how to use it. Tilt this into the person's mouth, inserting the tongue depressor over their tongue. Tilt their chin up and get a tight seal and pull back quickly on the plunger. Let's try it on my hubby. So place here, tilt it in. Okay, hold it on your face the way they say to do it. Sorry, love. Okay, I didn't get a good seal there. Let's try it again. No, okay, so here I'm not getting a good seal at all. And the problem is with this tongue depressor, it's in the way. I can't maneuver this mask to get a good seal. No, I'm not able to get, I'm just literally not able to get it over around your nose. A little bit. Sorry, love. Still Still not getting a good seal. I saw your cheeks going a little bit, but I still didn't get a good seal. Hold it with your own hands. Compress on the pillow yourself. So that last time I was able to get good suction, but that was only because he was literally squishing down the cushion with his own hands to have it tight against his face. Normally with a face mask, no matter what the shape of somebody's nose, I can maneuver the face mask to have it really get a good seal on their face. But with this tongue depressor part sticking in there, this was hitting on his teeth. Bottom line, I could not get the Dechoker to work on either my face or my husband's face because the tongue depressor got in the way and I couldn't get a good seal. I tried the pediatric version on my kids about 1 or 2 times, but after that they refused to let me try again because they found the tongue depressor part so uncomfortable. Last point for both of these, if you choose to get one, you must practice with them. You cannot be struggling to figure them out for the first time when someone's life is on the line. But enough of trying it on my husband, who is an N of 1. We actually need to look at the data. In my next video, I'll look at all the data and the risks of using these devices, and then after that, I'll pull it all together for you.